Can I now call on our next speaker, Dr. Sumanth? Dr. Sumanth is our adult neurologist who has been a great support for us. All our children are becoming adults and he's taking care of them. Thank you, Dr. Sumanth, for all the support that you've given, especially with Spinal and other neuromuscular disorders.
Hi, good afternoon, everyone. Before I start, I'd like to thank Dr. Ann, the pediatrics team, and ORDI for involving me, and especially the patients and their families. So, I'm an adult neurologist. I don't see SMA patients very regularly, but adult neurologists see patients you might have heard of with motor neuron disease or ALS, which is a disease which is quite similar to SMA, although it is quite different also in many other respects. So it's been quite challenging because I've been seeing many adult patients along with Dr. Ann from last year. So maybe I can just share some of my experiences with these patients. So the first thing is that many people think, even in the medical fraternity, that SMA is a disease of children only, which is not unreasonable. Most of the patients are children, but we need to recognize that SMA can begin in adulthood also. And now with newer treatments being available, many of our children with SMA are going to go into adulthood and they're going to require continued care. So globally, maybe up to 35% of SMA patients are adults. So that is about 1 in 3 SMA patients, which is a huge number. So we need to be ready to provide services to these patients with SMA. So SMA patients who are adults do propose some unique challenges. For example, as patients become older, they would want to have more freedom in the choices that they make, whether be it medically or with other areas of their life. They would like to be as independent as possible. They would like to pursue life goals which normally come with adulthood, like completing their education, getting some meaningful employment, finding partners, and maybe even starting a family. So all these things need to be considered when SMA patients become adults. Some of the things don't change. Multidisciplinary care remains the cornerstone of treatment for SMA patients with adults. So even if you're an adult, you would get the same kind of care, which would be involve physiotherapy, orthopedic, speech and swallowing therapy, pulmonology. Everything still needs to happen like it happens with children with SMA. Some of the things that we would focus on in adults would be their sleep. I mean, it has already been discussed in detail, especially by Dr. Eilen, that sleep is very important. There's a tendency for patients with SMA to have what we call as hypoventilation because of muscle weakness, and this could cause a lot of symptoms when they're awake, especially tiredness, not feeling fresh, even maybe forgetfulness and things like that. So that needs to be addressed. Bone strength and bone deformities is another thing that needs periodic monitoring in adults. Diabetes is something that needs to be specifically looked for. Even children with SMA are at slightly higher risk for diabetes, but especially with adults, especially considering that many of them may not be ambulant, many of them may not be able to exercise as much. So they will be at very high risk of diabetes, and you don't want uncontrolled diabetes, which itself can cause a lot of damage to nerves, being superimposed on an already patient has a neurological disease. So you don't want two things. Cardiac issues are some things that are coming up right now. We are not very sure, but there does appear to be a slightly increased risk of cardiac issues, especially variations in the heartbeat, either heartbeat going slow or very fast. So these are some things that we would look for in adults with SMA. So of course, some of the most important things that we can do for patients with SMA is to look at their mental well-being. So it's a very challenging time. They have become adults. They want to pursue a lot of things which requires a lot of independence. They are under a lot of stress. There is a lot of frustration and guilt. So obviously mental health, focusing on mental health is very, very important for adult patients with SMA. So when we come to the goals of care for patients, adults with SMA, the first thing we look for is a proper transition from pediatric to adult care. So I've been fortunate that Dr. Ann has trusted me with the care of her patients with SMA. But still, it takes a lot of time. I mean, she has been, priming me that we'll have a lot of SMA patients who are going to be adults for the last 3-4 years. And, finally from last year when we started giving these SMA therapies, I was able to meet many of them. So it's very important. So your pediatrician has to trust that the adult neurologist that she's going to entrust you with should be able to give you all the required health care that an SMA patient requires. And this is a lifelong commitment. This is not, just prescribing medications and sending away the patient. This requires repeated visits. So adult SMA patients also require continued access to medications. And one of the challenges that we have faced, especially while using Spinraza for adult patients, is the difficulty in giving the drug to the patient. So normally Spinraza is given through an injection into your spinal fluid. So basically we identify some spaces between the spine bones and we inject it. Now, generally it's an easy procedure which most doctors would do, but patients with SMA have a lot of bone deformities. Though this, as we saw earlier, with a lot of scoliosis and spinal deformities, it becomes very challenging to administer the medications. But fortunately, there is a solution. We have a very good group of interventional radiologists and Baptists who are now giving these medications under ultrasound guidance. We also encourage that patients get their sugars checked regularly. It's very important if they're diabetic to have their sugars under proper control. Cardiac evaluation also is something that we do recommend at least once a year, at least an ECG and echo. Sometimes we do something called a Holter monitoring, which looks at your heart rate and your heart rhythm for longer periods of time, maybe 24 hours or even 1 week, if we suspect that you may be having a cardiac problem. DEXA scan is also something that is absolutely necessary, and sleep studies also is something that probably we should be looking into doing more often in adults with SMA. Finally, there are recommendations for vaccination, specifically 2 vaccinations that all patients with SMA, especially adult patients with SMA, should be looking to get is vaccination for influenza and for pneumococcus. So both these organisms cause lung infections, and patients with SMA are more prone for them, and they also tend to develop more severe disease if they get infected. So obviously preventing them would be very important. Frequent mental health, inquiry into mental health being, as well as offering counseling and maybe consultation with a clinical psychologist periodically would also be very important. Obviously, outside the hospital level, one of the most important things is to make sure that SMA patients are able to access all the things that other people access. So some of the studies in Western literature say that one of the things that SMA patients are frustrated about is their inability to access, just going outside, going to a theater, going to get-togethers because of lack of facilities. So that is something that also needs to be looked into. So when Dr. Ann came to me 3-4 years back saying that we are going to get a lot of SMA patients, many of them are going to soon become adults, I tried looking at the literature, seeing if there is any specific things, recommendations for adults, and unfortunately it is not there. So most of the things that we are doing for adults, we are extrapolating from pediatric patients. So probably the most important thing that we can do for our adult patients is to include them in all these studies. So we need to look at what is specifically happening with our adult patients. What are the specific problems that they are facing which is different from the pediatric populations? It is also important to include them in trials. So does risdiplam and Spinraza work as well in adult patients? So, and especially with future molecules, other newer drugs coming up, I think we need to have a concerted effort to include adult patients into these trials. Thank you very much.
So much, sir, for that wonderful talk. Now, may I request one of the patients' father, Mr. Shafiq Ahmad, to felicitate Dr. Sumanth.